Thank you for having me. I've been really looking forward to giving this talk and providing more support to our parents and caregivers. I think we can all agree that the past couple of years have been really trying for everyone. For parents and caregivers particularly, it has required tremendous flexibility and resiliency to cope through this pandemic. For many of us, we were caught by surprise by how long this pandemic persisted and learned a great deal about our capabilities. With school closures and social distancing, caregivers were required to take on additional roles as teacher or play partner to accommodate their child and family's needs. Within that, many caregivers experienced a learning curve adapting to these challenges and operating within a new normal. Understandably, difficult reactions and/or interactions may have surfaced in your family and may be continuing to cause distress. My hope, particularly as we move into this new year, is to help you move from a place of reacting to manage challenging behaviors to being more intentional with encouraging and shaping positive behaviors in your child. My goals within this webinar are to provide you with, one, a foundation of positive parenting strategies that you can lead from. Two, knowledge as to why misbehavior may be occurring. Three, arm you with specific parent management strategies to mitigate challenging behaviors that are causing distress within your family. These core concepts will work in conjunction to strengthen your child's compliance and family functioning through the use of evidence-based behavior management techniques. I will frequently be referring to the role caregiver throughout this talk. I want to highlight that I will be using this term to apply to a broad array of important individuals, including biological, adoptive parents, foster parents, single parents, step parents, older siblings, and other relatives and non-relatives whose presence shapes the health and well-being of children. So today I'll be talking specifically from a behavioral therapy lens. I want to highlight that there are hundreds of different kinds of therapeutic treatments available for caregivers and their children, many of which are effective and helpful. I encourage the use of behavioral therapy for a couple of reasons. It's evidence-based, meaning there has been significant amount of research done indicating its utility, decreasing maladaptive behaviors. It focuses on the idea that we learn from our environment and encourages appropriate modeling and use of reinforcement. It is action-based and solution-focused, which allows for a shorter-term treatment approach. And it enables the caregiver to identify targeted behaviors within a challenging dynamic to then teach new or more desired behaviors. The two central behavioral therapy approaches I'll be speaking about are positive parenting, which can be started as early as birth. This approach establishes a solid foundation of positive parenting behaviors to foster healthy child development. And then parent management training, which is an effective method for decreasing the presence of more significant challenging behaviors in children. Concepts and strategies are most suitable for a child with a developmental age of at least 2. This approach is intended for externalized behaviors that persist despite the use of positive parenting strategies and include behaviors such as hitting, lying, and stealing. Let's start by talking about positive parenting and the approach we can use right from the start. The concepts within positive parenting seeks to promote the parenting behaviors that are most essential for fostering positive youth development. This is done through striving to show children love, warmth, and kindness, guiding children to act in a desired way through encouragement and modeling, and aiming to send the powerful message to children of you are loved, you are good, and you matter. When we think about using positive parenting as a foundation in which we parent from, these bullet points should be considered essential structures by which we operate from. Praising and reinforcing desired behaviors, setting and communicating clear expectations, allowing for developmentally appropriate collaboration between the caregiver and the child, and avoiding the use of harsh consequences, such as physical punishment. Our attention to our child's behavior plays a critical role in their development and formation of healthy relationships. First, it contributes to their sense of value. When we respond in a positive and loving way, we help build our child's self-esteem. Second, it enhances connection and attachment that will influence their ability to have healthy relationships down the road. We also know that attention shapes behavior, whether it is positive or negative. Research indicates that positive attention and reinforcement is the most powerful way to shape behavior. So although it may seem silly or backwards to be talking about positive attention when we're trying to address negative behaviors, it is a critical tool in shaping behavior. Selective attention provides caregivers with an opportunity to teach their child the behaviors that they want to see, while also showing them that they enjoy their good behavior. An example that I like to use to clarify this concept is a caregiver is making dinner, their children are playing in the next room. The caregiver overhears a squabble between siblings regarding who's going to play with a desired toy. The caregiver yells from the room, "You need to start sharing." An alternative approach that aligns with positive parenting would be to find opportunities when your child is sharing and catch them in the action. By providing immediate reinforcement for their desired behaviors, you are helping promote them sharing in the future. Jacob, I really like how nice you are sharing with your sister. To expand on this notion of fostering healthy caregiver and child connection, while also teaching and shaping behavior through attention, I'm going to reference the PRIDE acronym. PRIDE skills are a component of the highly effective positive parenting approach, parent-child interaction therapy, also known as PCIT. PCIT was developed by Shyla Iberg and is an evidence-based treatment for young children, 2 to 7 years old, displaying behavioral problems. Within PCIT, caregivers are taught these PRIDE skills: praise, reflection, imitation, description, and enjoyment to promote their child's use of positive behaviors while simultaneously improving the parent and child relationship. This helpful handout, developed by UC Davis, breaks down the benefit of each PRIDE skill and how to apply them within your daily interactions. Let's take a closer look at each one. Our first rule is praising appropriate behaviors. We do this because we know that by encouraging desired behaviors, we are letting our child know what we like. An example of how you can provide praise during a play interaction would be to enthusiastically say, "You did great concentrating on building the garage." The second rule relates to reflect, which means repeating their use of appropriate talk. This allows the child to lead the conversation while showing them you're listening and understanding. If your child says to you, "I did it all by myself," you are encouraged to respond, "Yes, you did it all by yourself." The third rule, imitate, pertains to imitating their appropriate play. This shows approval of their desired play through the use of your modeling. While copying your child's play, you can say, "I'm going to tap the blocks quietly, just like you." The fourth rule, describe appropriate behavior, increases your child's concentration and attention to the activity. This is particularly helpful for active children who have a short attention span. By saying, "You're keeping the Play-Doh on the table," you are encouraging sustained engagement towards an appropriate activity. The last rule, enjoy, simply means showing genuine interest in playing with your child. Through smiling, providing eye contact, and contributing to their play, you are showing your child that you have fun playing with them. The second page of this handout reminds us what we shouldn't do within our application of the pride skills. So we want to avoid using negative words such as no, don't, stop, quit, and not. This doesn't tell the child what we want them to do. Rather, it can create negative interactions such as a power struggle or conflict with your child. So rather than saying, "Stop running in the house," it's suggested that you say, "Please walk inside the house." We also want to stop criticizing. By criticizing, we are focusing on negative behaviors, and again, not providing direction as to what we want our child to do. Saying things like, "You're acting like a baby," or "That's not how you do it," is not an effective strategy for promoting behavioral change. Avoid giving commands and asking questions. Some examples of this include telling them what to play with or asking them what color something is. Instead, allow your child to lead the interaction and lean into their play while using the pride skills: praising, reflecting, imitating, describing, and enjoying the interaction. And lastly, ignore their inappropriate behavior unless it's dangerous or destructive. This allows the child to see the difference between your response to their favorable versus unfavorable behaviors. An effective strategy when misbehavior does come up during the play interaction would be to redirect them to another toy. "I'm going to make some cookies over here. Oh, they are so tasty." Establishing regular one-on-one time when you can intentionally practice these pride skills further encourages your ability to catch your child doing desirable behaviors and provide immediate attention. Research indicates that setting aside as little as 5 minutes a day to use pride skills can affect positive change and improve your relationship with your child. And we call this special time. So here's a more condensed list of general guidelines that align with the pride skills to structure your special time with your child. Designate about 5 minutes a day to have special time with just your child. follow your child's lead. Identify activities that encourage creative and collaborative play without a lot of rules. Try to relax. Describe out loud what your child is doing. Reflect what your child says. Praise and give positive feedback. Avoid asking questions and giving commands. And use selective attention for misbehaviors. I want to also mention that it's not only kids that will enjoy special time. Parents should also feel the benefit of engaging in a low expectation interaction where the emphasis is on enjoying each other's company. Before we move into exploring why misbehavior occurs, I want to clarify how I'm defining challenging behaviors, because it can look and sound different across children and households. Challenging behaviors relates to non-compliant and or externalizing behaviors such as yelling, whining, throwing objects, lying, arguing, teasing, and swearing, to name a few. Externalizing behaviors pertain to behaviors that harm or impact others. We know that some amount of non-compliant or defiant behaviors are normal for children. For example, it is common for preschool-age children to test limits as they are building understanding of their sense of self and autonomy. And these infrequent occurrences of developmentally appropriate misbehaviors should not be pathologized, but rather effectively addressed. More formalized behavioral supports are warranted when challenging behaviors are occurring frequently, are negatively impacting the child's development and use of adaptive living skills, and are causing a high level of emotional distress. Obtaining a psychological assessment that includes behavioral rating scales is a good first step in understanding the impact that the challenging behavior is having at both home and school, and whether psychological treatment is recommended. To better understand why children misbehave, it's important to distinguish the function of their behavior. There are generally two functions to most behaviors: reinforcement and avoid and escape. If you think through a variety of situations, you can usually identify one of these two contributing to your child's actions. For example, if your child is hitting, it's likely that they are seeing some type of reaction or attention to their behavior. Investigating why they are hitting. Are they frustrated, tired, unable to effectively communicate their emotions? Is a good place to start in breaking down their undesirable behavior. When child misbehavior persists, it's helpful to take a deeper look into other potential contributors that may have created and or are maintaining the maladaptive behavior and subsequent dysfunctional interaction. Dr. Russell Barkley, who's a leader within the field of neurodevelopmental disorders and defiant behaviors in children, conceptualized that there are 4 major factors that play a significant role in child misbehavior. Those are the child's psychological characteristics, parents' characteristics, situational consequences, and family stress events. In the following slides, I will speak in more detail about each of these factors and what it all includes, as well as I'll walk you through a case example regarding Josh. Josh's story will help illustrate how these factors can contribute to the onset and continuation of dysfunction. Okay, so a child's psychological characteristics includes their temperament, specifically their activity level, their attention span, emotionality and irritability, sociability, response to stimulation, and habit regularity. The greater the deviation from what is considered typical, the greater the likelihood is of conflict developing. Other components to consider are whether physical characteristics and developmental disabilities are present. In the case example I've provided, Josh is an 8-year-old boy who appears to run on a motor. He can engage for a short period of time in desired tasks, but prefers to be on the move, building, climbing, and running. This provides you with some insight related to Josh's temperament. Parent characteristics include inherited predispositions, such as the presence of psychological disorders, characteristics of their temperament, physical features or disabilities, and learning differences. In regard to Josh's caregivers, he lives at home with his 2 biological parents, mom and dad. Mom reports previous academic challenges, but is now a successful entrepreneur whom opened up a popular gym in their community. She can be emotionally reactive. Dad reports excelling academically at school, but has historically had a difficult time making friends. He is employed as an engineer, and he experiences some social anxiety. Situational consequences refer to the effect of the environment on the behavior. I must emphasize that children do not behave without cause or reason. Child behavior is not random, but rather it occurs because of a particular predisposition, learning history within the family, and consequences, whether that be positive or negative, that occur following the immediate situation in which the problem behavior arises. In Josh's case, when he does not finish his homework, his parents respond by trying to coax him into doing it for several hours. This often results in everyone feeling frustrated, and Josh ultimately losing privileges such as watching his favorite TV show before bed. Over time, Josh has become highly resistant to doing any type of homework. Family stress events is the last contributing factor, but should not be underestimated. A few family stress events include personal problems, marital relationship, health and financial problems, occupational, problems with relatives and friends, and problems created by siblings. Josh and his family, like many others, have been impacted by the pandemic, and there have been several occasions when Josh has had to participate in school via virtual learning. When this occurred, parents took turns teaching and supervising him. Additionally, mom's gym lost money due to a required closure and low attendance, and there is uncertainty about the gym's future. It's undeniable that Josh's family is experiencing unprecedented stress. So as you can see, each of these factors plays a role within the cycle of understanding child misbehavior. The reciprocal interaction between these factors further perpetuates the cycle / maintenance of child misbehavior. For Josh, you can see how the family's harmony is disrupted by individual, parental, situational, and external stressors. So we see with what he's presenting individually, there are these innate challenges within attention. The parents also bring forward mom's sometimes likelihood to become emotionally reactive, and dads struggle with anxiety. And then within the response of Josh exhibiting challenges with attention, they are placing negative attention on his non-compliance to engage in his schoolwork, all while experiencing the stress of the pandemic and Josh having to move to virtual learning. Mom's job feeling uncertain and there being potential financial issues at play. Josh's challenges with inattention would best be addressed through teaching parents behavioral strategies that reinforce and promote his focus, while also considering their family dynamic and stressors that may impact their implementation. Generally, caregivers should focus on these three takeaways when conceptualizing why their child is misbehaving. Recognizing risk factors. So thinking back to the slide related to inherited predispositions, characteristics, what are you and or your child bringing forward related to temperament and learning style? Is there presence of a mental or physical disability that needs to be taken into consideration? And then attempt to make changes to risk factors if possible. If you're unable to make changes, then focus can be shifted towards learning to find peace with this and striving to cope. Remembering that you always have the ability to change the situational consequences you're providing for your child's challenging behaviors. Okay, so now that we have explored the fundamental concepts related to positive parenting and why challenging behavior occurs, I want to move into providing more targeted behavioral strategies for more significant oppositional and or aggressive behaviors. Parent management training, PMT, sometimes referred to as a behavioral parent training, is one of the most investigated treatments available for treating disruptive behaviors. There's plentiful research indicating its efficacy in reducing child misbehaviors and ultimately improving family functioning. This model was initially developed in the 1960s and was inspired from operant conditioning, which is shaping behaviors through reinforcement. Treatment, which typically lasts for several months, focuses on parents learning to provide positive reinforcement, such as praise and reward, for children's appropriate behaviors, while also setting proper limits and using methods such as removing attention for their inappropriate behaviors. PMT strategies can be effective for parents who would like guidance on typical parenting issues. And it's not required that a child have a clinical diagnosis related to oppositional or defiant behaviors. An important starting point within PMT, much like other behavioral approaches, involves getting parents to clearly identify the behaviors existing within the labeled quote unquote problem. Oftentimes, parents will not realize what they are trying to diminish. For example, oh, my child has such a bad attitude. I need to get rid of this bad attitude. Well, that's too subjective, and therefore it's really difficult to adequately target. But by prompting parents to identify what they hear and what they see, there's increased awareness that's established related to the actual behaviors they're attempting to lessen or extinguish. Here we'll talk about the example of whining. So we want to look in further to what we hear when our child whines. So oftentimes it's a higher pitch. Perhaps the child is repetitive with their request. And then what we typically see is the child talking and usually pouting. So now we've clearly identified what whining really is. Once we have identified the behavior to target, the next step would be determining the positive opposite of that behavior. So here I've elaborated on the example of whining. The positive opposite of that behavior would be making a request one time, saying please, while also using an appropriate tone of voice. Almost all unwanted behaviors have an opposite, more favorable behavior. When you reinforce your child for displaying the favorable behavior, it helps them learn what to do rather than what not to do, as well as it increases the likelihood that they will do it again. I've provided a few other examples related to finding the positive opposite and how to decrease the challenging behavior that you're seeing while promoting the positive behavior. So with fighting with siblings, when we're wanting to see this decrease, we want to reinforce sharing, having nice hands, using kind words. When our child exhibits these behaviors, that's when we really want to jump on and praise and reinforce. With lying, we want to reinforce being honest and telling the truth the first time. And then with having a tantrum, we want to reinforce when they're using a calm voice to express themselves, keeping their body safe, all of that. So there are some important guidelines to remember when providing positive reinforcement. Be immediate. Try to catch them in the act of doing that good behavior. Be specific and clear. I like how you put your plate in the sink. Be consistent. Consistency is really key to conditioning behaviors. Be close in proximity. It's not as effective to shout from the next room, so we really want to be up close. Provide eye contact if we can. Be enthusiastic, add facial expressions and a loving touch. And then here on the right, I've outlined some different types of praise and reinforcement you can provide. And that includes material reinforcement. This would be like giving your child a treat or cash, stickers, small toys. And then there's also privileges and activities that they can earn. This would be like getting to pick a fun weekend activity, getting extra screen time, getting out of a chore. And then there's also social reinforcement. And this is when you smile at them, give them a thumbs up, nod your head, and then token reinforcement, which refers to using like a sticker chart or a point chart. I've seen where people use punch cards or place jelly beans in a jar, all to show the positive benefit of their behavior towards getting a reward. to the slide one more second. So on the next slide, I'm going to speak about using a token reward system as a tool to shape behavior. So as I mentioned, there are several different ways that you can set up a positive reinforcement system in your home. I've listed here two main types. So the sticker chart, which is a supportive and simple measure for young kids, and it has the benefit of a visual aid and provides immediate reinforcement for the desired behavior that you're eliciting. And then a point chart or a token system, which you can creatively mold to fit into your family's needs. So for example, you can use a point chart with a tally system that is kept on the refrigerator. In combination with the use of positive reinforcement, it's also essential that we provide clear instruction as to what is being asked when we prompt our child. So within a prompt, be specific as to what you are asking. Pick up your shoes. Remain calm in your delivery. Be close to your child rather than yelling from afar. And give the reminder just before you want the behavior to happen to promote their success. And never prompt by asking a question. Are you gonna go put your shoes on? You'll likely get an answer rather than the action that you are requesting. It's also important that we be mindful of how many times we are prompting. When we provide more than 2 prompts, we move into nagging territory. Over time, children will then learn that they don't have to listen the first or second time because it's likely going to be told to them again. So we want to try to move from a place of nagging to providing more clear and effective prompts. So as we move into discussing how you can set appropriate limits and provide consequences that align with positive behavioral strategies, I want to review the definition of what discipline really is. It's likely that we all have different views related to the word discipline. For many, it may hold a negative connotation. I'd like to help you shift your perspective by reading how it is defined by the Merriam-Webster Dictionary. Training that corrects, molds, or perfects the mental faculties or moral character. So it's termed rather as educational and reminds us that as parents, we are not disciplinarians, but rather teachers and models for good behavior. As parents, it is critical that we set limits and provide consequences in unison with our positive behavioral strategies. I want to emphasize that consequences should never include physical punishment, verbal tirade, or prolonged consequences. Research indicates that these negative intervention strategies have a limited short-term success and can contribute to negative behaviors intensifying. For example, we may see children become more aggressive because that is what is being modeled to them. We also know that these types of these types of punishments negatively impact the parent-child relationship and do not teach our child how to effectively problem solve. In the next few slides, I will refer to more appropriate strategies for using consequences, such as being more effective with your use of reprimands and timeout. So much like delivering an effective prompt, it is important to be clear and concise in your use of reprimands. Here are the key steps to deliver an effective reprimand. Include what to do instead. Tell the child why they must stop and what to do instead. For example, I'm sorry, let me say that again. Include what to stop, why to stop, and what to do instead. For example, instead of yelling, "Stop" from down the hall while in close proximity to your child. Start over. For example, instead of yelling, "Stop" from down the hall while you're in close proximity to your child, provide them with eye contact and a calm tone and tell them, "Stop running in the house. You are going to hurt yourself or break something. Please walk." Remember, as always, we want to be mindful of times when they are walking nicely so that we can praise and promote this behavior so it can occur again. So just to reiterate there, what to stop, why to stop it, and then what you want them to do instead. All important steps when you're delivering a reprimand. There will be times when providing a reprimand is not enough to adequately address misbehavior. So for instance, if a child becomes physically aggressive, when this is the case, it is important that caregivers are consistent with using timeout each time the behavior occurs. So here I've highlighted the main steps of issuing and moving forward with timeout. Identify what behaviors occurred that warrant timeout. So you are going to timeout because you hit. Tell the child where they are going. You are going to sit in the office chair. Be clear as to how long they are going to timeout. So you will be in timeout for 5 minutes. And then show your child that you are setting a timer for the designated time. Caregivers have an opportunity within this process to praise positive behaviors that they see, such as walking towards timeout and successfully completing the timeout process. It is important that caregivers are reasonable about the amount of time they issue for timeout. A good rule of thumb is 1 minute for each year they are old. So for example, it would be 5 minutes for a 5-year-old. How immediate and consistent the punishment is more important than how big the loss is or how upset your child becomes. Timeout can be modified to include materials also going to timeout. So for example, if a child becomes dysregulated using an iPad, the iPad can be removed for a certain amount of time. And with the process, you'll want to just follow similar guidelines as you would with timeout. I highly recommend explaining how timeout is going to look moving forward. And you would want to present this process during a time when everyone is relaxed and in control. You can explain the procedure. I think it's helpful if parents role play what it's going to look like. And then ensure that the child knows what behavior warrants a timeout. So, if we see you hitting, that means that you are going to go to timeout. And then also ensure that they know where they are going to take the timeout. And I recommend finding a place that is away from a lot of stimulation. I don't recommend their bedroom because I think that they can get distracted by some things in there, but rather a place that you can kind of keep an eye on them without being right in front of them. And then also let them know how long they're going to be in timeout for as well. So in order to consistently use these parenting strategies, it is vital that caregivers are making efforts to take care of themselves. Parenting when children are behaving is hard work, and parenting when children are testing limits is exhausting. So being aware of how much fuel you have in the tank to use these strategies and skills and be consistent is essential. I would recommend being proactive in scheduling self-care, regular, brief moments that you can relax your body and your mind to recharge. Strive for nourishing your body through exercise, eating healthy foods, and using healthy coping skills. Don't neglect the person that you are, in addition to a caregiver, and pursue activities that contribute to your growth. So now I want to circle back and ask you, are there any changes or tweaks that you can make within your own parenting to intentionally integrate these concepts? I hope each of you can take away the importance of catching your child doing a favorable behavior and praising it, providing clear and consistent expectations, allowing your child to feel heard while also providing developmentally appropriate guidance, and avoiding the use of harsh consequences such as physical punishment to effectively teach problem solving and emotion regulation. When we operate within the framework of positive parenting, we are promoting optimal development for our children, and we're enhancing the parent-child connection. The additional tools that I provided within the parent management module of this presentation, such as the use of a point chart, will be elaborated on during my 4-week psychoeducational course later this month. We will also be diving further into caregivers' use of selective attention and active ignoring, and learning how to effectively compromise with your child. Here are my references for this presentation. I want to thank you for sharing your morning with me and being open to hearing strategies to support your child and family. And then just this last slide here brings up those main points related to that 4-week psychoeducational group that I'll be hosting at the end of the month. Again, taking a deeper dive into some of these concepts, particularly within PMT. So creating that positive reinforcement system, using selective attention, active ignoring, and then learning to effectively compromise.
Well, thank you so much, Kyle, for such a wonderful and informative webinar. I see someone just asked a question, I think, about this class that you are talking about. Can you explain what each week goes into more?
Yeah, absolutely. So the first week will really bring everyone together to understand what's happening in your house, what are the behaviors that your child is exhibiting, and then getting you to break down what exactly those behaviors look like and sound like so that we can better target them. And we'll incorporate strategies such as setting up a positive reinforcement system with your child. I'll help coach parents in using selective attention to praise the positive behaviors that you're seeing, while also ignoring or applying appropriate consequences for those negative behaviors. And then I'll also provide you with more information related to the framework that you can operate from when compromising with your child.
Great, thank you. And then another question is, will we be able to provide an example of a situation that might have occurred so we can go through it with you?
Absolutely, yes. So with these smaller psychoeducational groups, I'll be able to provide more hands-on support and individualized strategies. And so each week you'll have the ability to share and gain, clinical insight from myself, as well as hear from other group members as well.
Great, thank you. And then there was a question earlier when you were going over the pride skills, how these skills can be used for, I think, I'm trying to find the actual question, but I think it was about a more challenging behavior. I think as you went along in the webinar, you did address discipline and kind of the importance of positive reinforcement of positive behaviors and how to manage more challenging behaviors. Any kind of broad strokes of how to answer that question and that concern?
Yeah, absolutely. So during special time, I would address it by selective attention. And, if you are able to ignore the behavior, if it doesn't go into the territory of being dangerous or having a health and safety issue, then I would recommend that approach, and redirecting your child, as I mentioned, like, oh, look what I'm doing over here. If it's generally happening outside of special time, then using some of those appropriate consequences, such as being more effective with your reprimand, or if it falls into the territory of timeout, making sure that you're really consistent with that use.
Great, thank you. Sorry, I'm just trying to find this other question I saw. But in the meantime, while I search for another question that popped up in the chat. One parent says, although I'm very grateful my children have returned to in-person school, I'm having a very difficult time getting them out the door in the morning. Any tips on how to speed up this process and start our day off on a better note would be greatly appreciated.
Yeah. Several different approaches that you can use there. And I think that I can validate your challenge getting out the door. I think that's a common happening in households post-pandemic. But some of the behavioral strategies that you can use are increasing structure within your house, and what's happening that morning, and clearly communicating to your child what expectations that you have for them. And I think that can be done for a child at any age, and you'll just want to simplify your language for younger kids. You can use a visual timeline if you feel like that would be helpful for a younger child, or a child that has some executive functioning challenges, to show them step by step what needs to get done in the morning to get out the door. So after brushing our teeth, we are going to put on our shoes. That would be a supportive measure. Being effective in your prompts. So referencing back to that slide, if you can be clear and concise within your delivery. Don't prompt too ahead of time. Try to do it like right before you're wanting the action to be completed. And then you can also set up a positive reinforcement system. So identifying, if they get out the door by 8 a.m., they can earn a point or a sticker, and that will equal some type of reward that they've identified is motivating to them.
Great, thank you. Yeah, I know personally, one of the most helpful things is actually the close proximity to my kids and making eye contact before the prompt. And I think as adults, if someone was telling us to do something from another room and we were distracted by an email or whatnot, it would be easy for us to kind of not really absorb or process as well. So I found that piece to be incredibly helpful.
Can't even hear what people are trying to see you across the room. So
exactly. And then another question was, how long is each session of the 4-week class?
Yeah, great question. 75 minutes.
Great.
And the group is going to be held this time around on Friday mornings at 10 o'clock. So 10 to about 11:15. And it will all be held virtually.
Great. Yeah. And that's Pacific Standard Time. So let's see, will there be an opportunity to discuss executive functioning and strategies to support that kind of child? My son has auditory processing and ADHD. So I do see when some of these executive functioning tools help reduce some of the behavior outbursts.
Mhm. Yeah, so these behavioral strategies can be applied across a range of different individuals, including those with neurodevelopmental challenges. Um, there may just need to be some modifications to the use and delivery of these behavioral strategies, but we can talk more in detail about that during the group. But that is, yes, something that we can address.
Great, thank you. There's also on our Stanford Parenting Center YouTube channel, there is also a free webinar for parents of children with ADHD and executive functioning challenges that focuses on organizational skills ideas. And so that also might be a helpful resource to check out as well. And we're hoping in the spring to have a parent class focused on executive function support. And at the same time, there's a lot of overlap with the principles that Kyle's focusing on with this upcoming class as well. And then how many parents will be in the group and what is the cost? So just so you know, and I think we're just out of time, we are out of time here, but you can also email us with any questions you have about this class or any other classes. Emily, can you please put in the chat our email address so that everyone is aware of where you can direct our questions? Thanks, Emily. So parentingcenter@stanford.edu. And then I guess the last question will be, I saw another question earlier here. This will be our last question. Can you give tips for helping grandparents get on board with utilizing these techniques? They minimize hitting behaviors as rare and give up when the child does not follow directions.
Yeah, really important to be consistent amongst partners as well as in other environments. So I would encourage opening up communication with grandparents around what the expectation is. So we really don't allow for hitting, and hitting behavior warrants a timeout. And the timeout program that I referenced can be applied to situations outside of the house. So if you're in the car, having your child sit in the back seat and still take that time can definitely be doable, as well as if they're at grandparents' house, designating a place that they can sit and a timer can be set and the full process can be completed is a realistic expectation.
Yeah, thank you. Yeah, I think there is a huge generational shift when it comes to parenting philosophies and principles, and many parents struggle with this different in parenting perspectives between grandparents and how we're trying to parent. And so sometimes letting grandparents know that you're basing this on parenting psychology that's based on research for what's been shown to be really effective and helpful for children. So letting them know that what you're trying to do, although it may be different from what they did, it is based on science and research. And the other thing is it's okay if they don't agree. As parents, it can be hard, very hard to feel judged by others, especially our own parents, our in-laws. And so just being able to understand your rationale and be confident in it, and that others may have different perspectives, and that's okay. And you are the parent of your family, making choices for your family can be helpful to kind of think about, sit with, and talk about with your partner if you have one, and be united in that. Because there's so many different perspectives on parenting, as Kyle talked about. And it's not that there's one right or wrong way, it's more which one makes sense for you. And perhaps if you're joining us here today, you have an interest in also following parenting ideas that are more grounded in science and research as well. So we really appreciate your attention today. And again, please feel free to email us with any questions you have. Please check out our YouTube channel for other free webinars. And also our Instagram page is a way to also find out more information about parenting in general, and also about the specific classes and webinars that we're continuing to offer. So you could email us, you could DM us, and so on. All right, take care, everybody.
Thank you, everyone.